Now, the Health Department has called for calm over the measles outbreak in Gauteng. The National Institute for Communicable Diseases reported 4 laboratory-confirmed cases in the last 2 weeks of May. Researchers say measles remains a threat in countries across the globe, despite the fact that there has been a vaccine since 1963. Measles vaccines are free of charge at public health facilities and are administered at 6 months old, with a booster at 12 months old. For more on this, I'm joined by Professor Susan Goldstein, a public health medicine specialist at the South African Medical Research Council, or WITS Center for Health Economics and Decision Science. Now, a very good afternoon to you, Professor Goldstein. Thank you for your time. As the country's health authorities are testing, quarantining and treating individuals, around 2 years ago, we who have been exposed to the new coronavirus, you were already of the view that coronavirus risks forcing South Africa to make health trade-offs it can ill afford. What did you mean by this? I mean, you preempted what we're experiencing today.
Thanks very much, Paul, and good afternoon. What we meant is that a lot of our resources were diverted from ordinary routine immunization, for example, like measles, to the COVID vaccine and the COVID virus, dealing with it. But also we had lockdowns, so people had much more difficulty accessing health places that they could go to. And so what we saw over the period of particularly of lockdown, and we did some research into this, we saw that there was a huge decrease in immunizations, measles, and fully immunized children under the age of 1. So there was a kind of it was expected, and I think what people don't realize is we are also sitting on a base of not a very good coverage of measles immunization. The 1990-20 coverage in 4 provinces was below 80%. Now for measles, that's just not high enough. You have to have it at least in the 90s. So we were already starting at a low base, and the corona pandemic just threw us all.
Health and medical experts like yourselves are warning that measles is a threat, and it's something that needs to be dealt with rather urgently. How significant is that, especially looking at what we're experiencing with COVID-19 and the under 5 years age group?
So it's interesting because in the under 5-year age group, actually during COVID, children were exposed to fewer pathogens, and it seems that fewer died in facilities. We don't know how many children died at home, and that may have been a significant number. But the problem with measles, and one of the biggest issues, is that it is particularly severe children who are immunocompromised or malnourished. And so we've got lots of children now who are very hungry. We've got an increase in malnutrition, being children who are malnourished being admitted to hospitals because of the consequences of the COVID pandemic. And these children are very vulnerable to not only deafness, all sorts of disabilities, but also death from measles.
What are the symptoms?
The measles it's a viral infection, so you get a fever and then you get a rash. Very often children get secondary infections, so they get ear infections or they get coughs and colds. It's quite easy they have what is called conjunctivitis, so their eyes get red. It's fairly easy diagnosis, but funnily enough, we haven't had that many measles cases for many years because we've had fairly good coverage of vaccination, and children haven't been as malnourished as they are starting to get now.
There's also been a warning that the traditional non-pharmaceutical interventions like maintaining hand hygiene and physical distancing are not enough to prevent the spread of measles. Is the vaccine 100% effective?
There's nothing that's 100% effective, but the vaccine is very effective. And if we can vaccinate enough children, if we have, say, 95% of children covered, then we could actually eradicate measles completely. But this, of course, is very hard to achieve, particularly here in South Africa.
What are the dangers of not dealing and ensuring that you act very quickly when it comes to a child, especially under the age of 5, who may have measles?
Well, it's the side effects, it's the complications of measles, which are really the ones that cause problems. So, for example, extreme fever can cause convulsions, but ear infections can later cause deafness. There's all sorts of other complications, and then there's diarrhea, dehydration, and death. So it's important to get help, to make sure that you've got the right treatment, that you are taking temperatures down and so on. But I think 4 cases of measles is not really of major concern. I wouldn't necessarily be concerned. What I would do, though, is make sure that my child that's under 1 year of age is definitely vaccinated.
There's been a diversion to other tasks related to COVID-19, compromising immunization and treatment of other ailments. I mean, what can we learn from certainly the past ailments and errors that have been made in the system when it comes to managing the immunization process and other diseases?
It's very difficult because we didn't know what we were dealing with at the very beginning of COVID. People were afraid. I don't know if you recall, and before we had a vaccination for COVID, people were dying a lot. So it's easy in retrospect to say what we should have done. I think there are a couple of things that we should be doing going forward. The one is really emphasizing how incredibly important immunization is for children, and try and get our base immunization rates high so that it becomes normal for children, and it is actually the norm for children to be immunized. I think that's the sort of the starting point. But there are other things. Maintaining hand washing, keeping the hand washing is very good, for example, for transmission of pathogens that cause diarrhea. If you have access to clean water, we have to try and make sure that we've got enough food for children, because children who are malnourished are the ones who are most vulnerable to severe illness. So we really need to be looking at how to make sure that no child goes to bed hungry.
Very well. Thank you so much for your time. Thanks for weighing in on this conversation. Professor Susan Goldstein, a public health medicine specialist and Deputy Director and COO at the SAMRC Center for Health Economics and Decision Science.